In this video you'll learn how to scan for occlusal splints and register an increased interocclusal distance, or a construction byte, using a byte index. The general workflow presented here is to scan both jaws and the byte. Verify if the result meets the specific requirements, and then send further to design and/or manufacture. Start from setting up the case. Select the New Patient tab, or choose the patient from the list and create a new case. In the Send To page, select In-house or an external service provider. When in the order form, choose Appliances and then Splint. If you need to specify which type of splint the lab needs to make, use the Comments and Attachments field. Press Next. Start by scanning the lower jaw, following the recommended 3Shape scan strategy, which is scan the occlusal surface from the molar to the canine. Wiggle the scanner when passing the centrals and continue until you reach the last molar. Roll over the last molar and turn slowly lingual until you reach the other side. Either use the tip to keep the tongue away or enable AI to suppress unwanted soft tissue. Roll over the last molar and scan the buccal area for the whole jaw. When scanning jaws, you need to remember to make sure the scan has no or very little missing data and that it is trimmed well. You should check for any missing data spots. You can choose a highlighting color in the settings to accent the missing data areas. Now make an additional scan if needed. Depending on the occlusal splint type, make sure to also capture at least 2 to 5 millimeters of soft tissue. Inspect the scan when completed and move to the next step. Move to the upper jaw and scan it following the 3Shape scan strategy. Start scanning from the occlusal surface of the molar to the canine. Slowly wiggle the scanner while passing the centrals and continue scanning the occlusal surface on the other side. Roll over the last molar and scan the buccal side until you reach the last molar on the opposite side. Then move to the palatal side, going along the whole arch. Scan palatal starting from the incisors and slowly go from side to side across the palate in the distal direction. Inspect the scan when completed and move to the next step. Before you move on to the byte scan step, prepare your preferred byte method and follow the recommendations to set it correctly. Make sure the scan exposes the canine region and the distal last teeth. When the gauge is in the patient's mouth, the jaws with the gauge need to be stable while scanning. Use the preferred byte method and remember to trim away unnecessary material, especially from the buccal side, so that the material will not cover the teeth. Insert the scanner carefully in the mouth and drag it to the side that you wish to scan. Scan the byte following the official 3Shape scan strategy. Try not to move the position of the inserted byte index. The scan should cover at least 3 to 4 teeth for a perfect alignment, even if the scan snaps together earlier. The byte will be aligned automatically. Please remember though, in some situations you may have to align manually. In order to do that, place 2 corresponding points, one on the jaw scan and one on the byte scan. Repeat this procedure for byte 2 on the other side of the jaw as well. Trio's software enables you to check clearance. When the tool is on, the color palette informs of a clearance value. You can verify if the registered jaw relation is correct. Hold and drag the values on the palette to change its scale and have a more accurate overview of the situation. When scanning is completed, move to the validation page, where you can check the scans and if everything is okay. Post-process the scan data before sending the case to the lab. After post-processing, on the Send page, click the Send button to finish the order. Now you should know how to take a proper trios scan for occlusal splints. We hope this was helpful, and thank you for watching.